this episode of the NLN podcast, Nursing Edge Unscripted, the surface track, and thank you for joining us. This episode is entitled Awareness and Affirmation, the NLN ACE Series for nurse educators and learners, where we will discuss the new NLN Advancing Care Excellence, or ACE, series of resources that serve to equip nurse educators with the necessary tools to teach care of LGBTQ plus people and help them graduate a nursing workforce that is both knowledgeable and culturally competent to meet the needs of LGBTQ plus individuals and to decrease the health disparities that they experience. To help us today, we have two very special guests, Dr. Beth Hallmark and Dr. John Mikovits. Dr. Beth Hallmark is the Director of Simulation at Belmont University and an Associate Professor. Dr. Hallmark has been involved in simulation since 2007. Belmont has a very active simulation program and intentionally integrates the health simulation standards of best practice, of which Dr. Hallmark contributes her expertise in their development. Likewise, Beth's expertise informed the development of the NLN ACE series that we will explore today. Dr. John Mikovits is an Associate Professor of Nursing at Moravian University. Dr. Mikovits has extensive clinical experience in cardiac critical care at St. Luke's University Health Network that included program development and implementing quality improvement initiatives. In 2016, he joined the Moravian University faculty. John's areas of expertise and research interest include exploring LGBTQ plus and transgender health with a focus on addressing the disparities and mistreatment often faced by these communities. Dr. Mikovits contributed to the development of the NLN ACE series and resources as a content expert. So welcome both of you, and thank you for joining me on this conversation.
Thanks for having us.
Yeah, thank you.
Great. So we'll just jump right in. And, this year or this conversation is really going to be highlighting the importance and the role that the ACE series has in our programs and in our classrooms and our simulation labs. And so I want to first start by just building a little background and to give our audience some information about the ACE series, how it came about, and maybe its goal. So if either of you want to jump in, yeah.
Yeah, I'd love to. Thanks. So initially, just the ACE series in general, really, just to give you a little background, is for helping to improve really the quality of care for any vulnerable or underserved population. And so if you're not familiar with the ACE series in general, it's really a great resource and you should look at it. But in terms of the LGBTQ plus series or the ACE plus series, this was really a mandate or a thought from our constituents. So the NLN surveyed their members, and this is what came at the top of interesting topics for us to actually do the next ACE series on. And so I think it's really important that we recognize that this is really a needed resource for us to have for our constituents. This series was actually funded by the Hearst Foundation. And so the Hearst Foundation has been a big supporter of the ACE series, and they helped fund this. And it's important that we recognize that because they recognize the importance of us helping to meet the needs of the LGBTQ plus individual. The overarching goal of this project is really to equip nurse educators with the necessary tools to help teach about the LGBTQ people and really help us graduate a nurse that is prepared and knowledgeable and culturally competent to meet the needs of these individuals. And that in turn will help decrease the disparities that they experience. And I think John can talk a little bit more about that later, but that's something that we really recognized as we were developing these.
Wonderful. Thank you. I want to talk a little bit more about the role that this series, specifically the ACE series, has in our nursing programs and in our classrooms and our learning environments. And so, I think there's been an increased emphasis on diversity, equity, and inclusion, DEI, and thankfully in our nursing programs and our curricula, there's been a very firm really call to action to increase our DEI content in our programs, our content delivery and our curricula, and also to really honor, I think, the DEI values in the way we respond to one another, the way we engage with our learners, the way we engage with everyone really in our organization. And so, I imagine that while most nurse educators understand the importance of the role of DEI, specifically LGBTQ+, in our nursing programs, just by the nature of us being nurses and taking care of our communities, I'm not sure that many feel comfortable with teaching these very specific specialty areas like LGBTQ+. And I don't know that there's comfort in exploring it with our learners. And so, I think managing that discomfort, I'll speak for myself, requires some real skill development and some advanced teaching skills. So I was wondering if you can share your perspectives on the role the ACE Plus series plays in our nursing education and what it might mean for us as nurse educators.
Sure, I think that's a great question because the series itself can reach any educator who is a novice in this content area and can be beneficial to anybody who is also considered to be an expert in this area. So I think that's a great question and really helps expand on what Beth has already said about the ACE Plus series and the ACE series in general. The overarching goal of this project really is to equip and prepare educators with the tools that they need to be as successful as possible to teach care of LGBTQ plus people and help us prepare the future of nursing or future graduates and the new nursing workforce that's then hopefully going to be prepared both knowledgeably and culturally competent enough to really meet the needs of this population. We know this population faces some significant health disparities. So the more that we can do to prepare the future nursing workforce, the better we will be equipped to minimize some of the health disparities that they face. The NLN ACE Plus series really has some really, really well-developed case scenarios that touch on a lot of major components of health of LGBTQ people, therapeutic communication, and also providing affirming care. And while we use 3 scenarios to kind of cover these content areas, it's still not enough to cover all the needs of LGBTQ plus people, but it really gives a good foundational understanding to the basics of providing equitable health, having therapeutic communication, and having affirming care for patients who really need it. There's some really well-developed teaching strategies that are provided that are incredibly helpful, and there's loads of additional resources that can be utilized to support faculty who are using these series. The resources are from well-known, reputable, affirming LGBTQ centers and nonprofits throughout the United States. And they have some really good resources that we also use to help develop some of these scenarios. But one of the things that you actually just said that kind of struck a chord with me is that you mentioned discomfort. And I think there's always going to be topics that we come across in life, in nursing and education, that are going to be uncomfortable for us to talk about. I don't think that means that we need to avoid them. I think that's just going to perpetuate some of the disparities that are already facing these communities. So if there's one goal that I would have from this whole series, it's that I want faculty to become more comfortable talking about these things that are uncomfortable. Because if we continue this avoidance pattern, then we're only going to perpetuate the disparities that these folks are already facing. So I'm really hopeful that the series that our team put together can really start to create some of these really important conversations about the health needs of this population and really provide some of those resources for faculty and students to start preparing and providing affirming care to these individuals.
You know, John, oh, go ahead, Beth.
Well, I was just going to say that as part of this team, my expertise was minimal at best in this area. And John and a couple of other people had a lot of expertise in this area. And I would say generationally, I'm older than most of the people that were, well, another person was too, but we really didn't understand the language, the vocabulary, the appropriate words to be affirming. And I learned so much. And one thing I said, we just presented on this at the NLN. And one thing that I learned while I was doing this, and I mentioned this at the NLN, was, no matter what your background is or what you believe, what your political background, your faith background, these are people. And it's so important for us to care for people as nurses, no matter what we believe. And what I learned in this situation and going through this is the compassion based on the things I heard that these people didn't get, the experiences that John and another expert really told us, some of the things that they go through. And those disparities they are health disparities in terms of getting care, but it's not just disparities, it's mistreatment in some cases too. And I learned so much about that, and the compassion that you have as a nurse for people in general was really, to me, just really brought forward.
So, John, I was actually wondering, because I keep hearing mention of the disparities that this community faces. Could you expand on those disparities to shed some light on, like Beth had just mentioned, like mistreatment being one of them, but can you expand and maybe even give a few examples or describe what this might feel like experientially from a person of this community?
Sure. I think Beth actually hits the nail on the head with the mistreatment, because that really perpetuates everything else, right? So if someone's mistreated because someone doesn't know how to care for them properly, whether it's intentional or unintentional, or they have a bias against someone in this community, that's going to prevent them from seeking care in the future, right? If you're not going to go to a place where you're being, treated poorly or not treated appropriately. So it really just perpetuates the disparities that they're already facing, because providers don't have the necessary knowledge to provide some really foundational basic care for this population. So a lot of it is avoidance of care, fear of seeking care, and then all those preventative things that should be screened for these people, it goes overlooked. So when they eventually need care, it's beyond the point where we're looking at prevention, secondary treatment. We're at the tertiary care now, because they have been avoiding healthcare for so long because of just the way they were treated. And that's a very broad statement that doesn't apply to everybody, but that's really a good general gist of, some of the major things that kind of put this population at risk.
And I think two of our cases really demonstrate that in the way we develop them. And so there's 3 different cases, and the two adult cases, both of them had delayed care because of the way they had been treated in the past.
This conversation also links me to, I've heard the word affirming a few times. Can you expand on the role affirming has, what it means and how we can do that as nurse educators?
I think most important to think about when it comes to affirming care, it's just care that's designed to support and affirm one's identity, right? It's as simple as that. If someone identifies as male and they look female, then treat them how they identify, right? Someone's gay, someone's lesbian, someone's bi, whatever it may be, treat the person as they are, right? So really affirming care is just designed to support and affirm an individual with however they identify personally.
That's great. And I like this word support and affirm, because to me, that feels like some tangible steps, as a nurse, and we can teach that to our learners because I think sometimes the vocabulary and the words that we use, I think it matters. And so this idea of supporting and affirming and meeting people where they are and how they identify is, I think, how our identity is really important to us. And I think no matter who we are, and if our identity is threatened or mistreated, it goes way beyond the surface and it becomes a much deeper felt issue. And again, that leads to what I'm hearing you say are these disparities of not going for care not returning for care, and then problems getting out of control. So I think this support and affirmation seems pretty critical and honestly very basic. Like we should be doing this for everybody. It seems very intuitive, but it doesn't always come out maybe in the words we choose, or maybe our tone and our body language. Is that accurate? Am I reading that?
Absolutely. It really is. It should be simple. It should be simple care.
So, the other thing I want to talk about is about how we can, as nurse educators, integrate these tools and resources into our curricula. And, I think nursing curricula has a long-standing history of being content overloaded. I think we might even need to come up with a new term, because I think it's more than even overload. We can brainstorm that later, but I think there's several priority areas that are receiving this non-negotiable pressure to be integrated, and that's such as DEI in general. But I don't think, and there are many others like climate change and disaster preparedness. There are many topics that are becoming high priority. And what I'd like to say is that how do we address these priority areas, LGBTQ plus care specifically, and balance the demands of our already overloaded curricula with really integrating these needs very well? How do we do that?
So that's a great question. And I want us to think, if you look at the cases, just based on the diagnosis of the patient that we developed. So one case is colon cancer, one case is a wound, and one case is an MBA or a bicycle accident. So if you think about how you could integrate those into your curriculum, and then the patient is the patient and how they identify and how we affirm that, is to me the answer. You don't have to do a special series on LGBTQ. You integrate that within what you're already doing, because these are people, and you don't have to me, you shouldn't, you can, select them out, but I don't think you should, because they're people and they have the same diseases that we have, or if we identify as something totally different. So that is my answer to that. I don't know if John has any other ideas, but that's one of our problems in nursing. We keep adding and adding and adding, but really you can include that within what you're already doing.
Yeah, I agree with that 100%, Beth, because we need to really just integrate it throughout the curriculum. It can't be a discussion for a day. It can't be a special topic course. It really needs to be integrated throughout. If you look at our textbooks and the lectures that we have, they're so heteronormative, gender normative, and every person looks the same, right? There's very little diversity in the images that we use, in the patient populations that we talk about. So we need to integrate that into whatever topic it may be. Not just have a special discussion about this population, because usually those special discussions that we have just, again, perpetuate some of those stereotypes. Looking at LGBTQ population and talking about mental health, HIV and AIDS, that's not it, right? It is so much more than that, right? So I think Beth is spot on with the need to really integrate these topics throughout the curriculum.
And, I think when we think about the teaching strategies to meet this outcome of integrating, the care of these populations into everything that we do, into all populations, I think I'm a little bit biased that simulation as a teaching strategy is one that's really helpful to do this kind of integration, because simulation comes with debriefing, and debriefing is a learning dialogue where there can be an exchange of ideas and the diversity of thought and perspectives can be shared and brought to the surface and unpacked. And I think that comes back to kind of looping us back to the skill set needed to do this work. So what what are your thoughts on that, on, using simulation and debriefing as one way to help bring light to these topic areas? And what is the skill set needed, if not simulation?
Well, I think, of course, because simulation is what I do, I absolutely agree that this is a great place. But again, it doesn't have to be a simulation about an LGBTQ plus patient. It can be a concept. So we could be doing a concept on, say, infection, and the patient has a wound infection. Say it's Jayla, and she's one of the she's the transgender patient, and she has a wound and it's infected. Well, we're talking about the concept of infection, and the patient happens to be transgender, and we include it that way. But back to the debriefing, that is where, when we piloted these, that was some of the conversations that the students were able to have, because some of the objectives for the actual simulations are related to affirming care, et cetera. But it might not be that might not be your objective, but that happens to be the patient is transgender. So of course it can be brought into your debriefing and included, especially if it is a topic that's uncomfortable for students, which I do find that students, these topics are more comfortable for students to talk about than they are for a 58-year-old me. So I do think, but I think it's just as much a learning curve for the faculty as it is for the students, really, to be honest with you.
Yeah, I think debriefing is really a key component to having a better understanding of this population, because I don't want to say it forces the conversation, but it provides the opportunity to have these conversations, which often are avoided. So I think it's a really good learning opportunity for both students and faculty to really have these conversations together and talk about why these are important conversations to be having about this population.
Yeah, and I would even, I agree with you, John, to take that a step further, that really we should. I try to avoid that word. It's a dirty word in my mind, because when we put things like should, it kind of puts expectations. But I think we can consider having dialogue as a teaching strategy in the classroom, in our offices. It's not just in debriefing and simulation. We can use debriefing strategies in every opportunity with our learners. So I would even take it a step further to say it certainly doesn't have to be simulation, but it does create this space to have a dialogue, which is, I think, very helpful.
I do, one thing that I think is important for everybody to know about the cases, if you're not familiar with the ACEs cases, is that the monologues are so powerful for people to hear. We just finished getting the last monologue for these, and we worked really hard, not we, but it was an effort to get the appropriate voices, and that was something that was really important, to make sure that they were accurate for the patients. And they're so powerful. If you have an opportunity and you're listening to this, to go and listen to those, I think they'll draw you in, and you begin to have care for the patient already, just based on the monologue.
That's great. I think because it makes that human connection. You can hear a voice, you can hear a tone of voice, I think you can hear emotion, I think it helps.
Definitely. We've actually started adding monologues to all of our sims, regardless, based on this model, because it really helps the students buy into it.
That's great. And I did, my thoughts coming back to me, Beth, you had talked about this idea of, you had mentioned that you feel like with your generation of with your age, that you may not know as much, and that it's really a learning curve on both sides, for faculty and for our learners. I just wanted to comment on that I learn the most from my children. I have Gen Zs. I'm raising little Gen Zs at home, and they teach me, about a lot of things about LGBTQ plus, about the language, about the community, and that's who I'm learning from. And I just want to take that. I don't take it for granted. I have a lot of gratitude for that. And I think as educators, if we create this space for dialogue, we can become the learner. just as easily as our learners can learn from us. We might know how to provide wound care, but we may not know the most up-to-date language to use with our community. And I just appreciate it.
Yeah, and we have to give each other grace too to learn that and to but to be intentional about it. I think that's one thing too. And there are some really great resources that John and the team have put in there for us to learn those things. And I think it's important that before we implement the strategies into our teaching, that we take time to be prepared before we run the sim, or if we would do it in a classroom or whatever, because the students will often know more than we will about this. And we want to make sure that we are doing the best that we can do to honor these patients.
That's great. So can I ask a little logistics question? With the ACE Plus series, are there resources explicitly outlined for the educator to review with regard to language and terminology and things like that, content expertise?
Yes. Yeah.
Perfect.
And they're provided, it's not a resource that we created. It's a resource that we provided that with a hyperlink. So it's constantly updated as terminology changes. So you'll always have the most update terms that are being used, vocabulary.
That's fantastic. So with this, I would like to transition to some of our, what I think are fun, rapid fire questions. Are you ready for that? Yeah.
Sure. Bring it on.
Wonderful. All right. So who wants to go first?
Beth can go first.
I was going to say, John, you go first. I'll go first.
Like this.
Yeah.
All right, Beth. So if you were to write a memoir, what would you title the book?
Why I Care. So I think that that's just related to my background, why I wanted to be a nurse, related to some medical problems I have and my family's had, and then why I continue to care for my family and then for others. So
awesome. What is on the top of your reading list right now for fun?
Yeah, this is a question I can't answer because when I try to read, I fall asleep. So there's really not much. I'm caring for elderly family members right now. And so I'm 24/7, either work or caring for them. So I don't read right now, but one day maybe I'll go back to reading again.
Wonderful. What is your favorite quote?
My favorite quote is, character is what you do when no one else is watching.
Love that. And if you could have dinner with one person, dead or alive, who would it be?
Yeah, the pious person to me would say Jesus, but it would be my grandmother, really. So that's who I would want to see. That's who I'd want to, who died when I was, 25. So yeah.
Yeah. I think those special relationships, they never leave us. And I know I have a very special relationship too with my grandparents. And I'm with you. That's who would be at my dinner too. So we could have a little grandparent dinner party.
That would be so fun.
It would be. John, can I throw these questions your way?
Sure. Same questions?
Yeah.
Okay.
So if you were to write a memoir, what would you title the book?
Let's see. I'll go with An Unfinished Painting. I guess because my life is and always has been kind of a work in progress, never really finished. Always more work to be done, another stroke to be had, if that makes sense.
It definitely does. And I also appreciate the reference to art, because I love consuming art of all kinds. What is on the top of your reading list right now?
So I am currently reading a book called Like Streams to the Ocean, which came after a book that I most recently read and absolutely loved, called To Shake the Sleeping Self by Jedediah Jenkins. It's just a book about this guy who was kind of terrified about, being stuck in that stereotypical life of, You got to go to high school, you got to graduate, you got to go to college, you got to get married, you got to get a good job, you have to have kids, you have to have a dog, like the white picket fence, this American dream type of life. And he went on a 16-month bicycling trip from Oregon down to Patagonia in Chile. And he really just, had a lot of self-reflection and like a really honest memoir about himself, his own internal journey and struggles. But it really spoke to me because it talked about his struggle to reconcile his sexual identity while living in a very conservative Christian upbringing, and really his value in travel as a way to really make connections with life. And I thought it was just a really good read.
That's fantastic. Can you repeat the title again?
Sure. It's To Shake the Sleeping Self, and the author is Jedediah Jenkins.
You mentioning this book, and actually with regard to some of the authors in their memoir talking about their sexual identity, I think about sometimes we could, as nurse educators, I think for our learners, sort of have some book club type of activities where we can take these books that really make a very big impression on our lives. And it does make me think, though, Beth, can you imagine telling nursing students, I want you to read your 500 pages in your nursing textbook, and oh, by the way, read this book? But, because who, I don't know any nursing students that willingly say that they have any time to read. But I do think about, though, how these books can have such a different perspective that a textbook doesn't give, and how they make an impression on us, and how we could share that with our learners. So I don't know if that's possible. I just, on top of our content overload, maybe not.
Well, some universities actually have a book, like their freshman book or something like that. And I think that's a great way to do it early before they get into their nursing career, possibly, for their nursing classes.
So John, I just thank you for sharing that book. I wrote it down because I'm certainly going to check it out. What is your favorite quote?
I don't necessarily have a favorite quote, but one of my good friends recently shared with me one that said, "You can't change the people around you, but you can change the people around you." And that really stuck with me. I thought it was a typo at first until I really stepped back and thought about it, and it makes sense. And it's something that's applicable in so many different situations in life, that you really can't change the people around you. They're who they are. You change, they change, but you can't change them. But you can change the people around you, meaning that, if you're surrounded by people who don't lift you up, you can change them, find new people. The people around you really bring happiness to you, and that should be a priority in anyone's life. So that quote kind of spoke to me, and I have it written down in a note in my phone, just look at it and reference it every now and then, because while I don't have a favorite quote, I think that's gravitating up the list to become one of my favorite quotes.
That's great. And John, I appreciate that quote, because I know in my looking back, I remember the very moment I learned that exact lesson, that you can't change people. Somewhere maybe in my young formative years, I kind of thought that I could make, change a relationship or change, how somebody viewed me or whatever. We think we can change people. And I remember realizing you can't. And I remember exactly, I think, what I was wearing, what day it was when I learned that lesson, I think because it was so powerful. And it was a relief to know, whew.
Yeah.
One thing to take off my list of things to do. Yeah. If you could have dinner with one person, dead or alive, who would it be?
I would definitely say my grandfather on my father's side, because he passed away when I was 2. So I have really non-existent memories of him, other than one where I remember running into my aunt's house through the front door, around the corner, and up onto his hospital bed with him in it when he was sick at the end of his life. And I think it'd just be awesome to have a conversation with him, because I think he really helped shape my dad to become who he is. And I think a long, good dinner conversation with him would really give me a good understanding, maybe the parts of who I am. I don't know. I think that's a great question, but I don't think I would change my answer. I think definitely my grandfather on my father's side.
That's great. I think there's definitely a theme here with the three of us that I think it sounds like we really can honor the, how people's influences on us and how we're sort of, who has such an impact on us and how we're sort of formed. So, all right. Well, thank you very much for joining me in this conversation. I appreciate learning more about the ACE Plus program, and thank you for sharing your wisdom.
Thank you.
Thanks for having us.
Thank you for joining us on this episode of NLN Nursing Edge Unscripted Surface. We hope you join us next time. Until then, remember, whether your water is calm or choppy, stay connected, get vulnerable, and dare to go beneath the surface.